Welcome back to the Data Doesn't Equal Outcomes podcast, where your host, Tristan Keelan, and his guests explore everything about data, from culture to metrics to telling quality improvement stories for the human side of analytics. Hi, everybody. Welcome to another episode of the Data Doesn't Equal Outcomes podcast. I'm excited today to have back in the studio Christa Foschio-Bebak, the Director of Quality Improvement and Training at CCNY. Christa, nice to have you.
Thank you. Thanks for having me.
All right, important topic today. It's often discussed, and we're going to dive into it today, is the difference between two terms we hear a lot, quality improvement and quality assurance. In health and human services, a lot of times it's the same role, it's the same department. And today we're going to talk to Christa about really driving a wedge in between those two so we can understand the differences, but also the similarities, and how health and human service organizations can navigate the difference to make sure you're doing both. So Christa, I'd like if you could kick us off with a little bit of education. Sort of how do we define QI, quality improvement? How do we define QA? And then we can talk about what are the distinct similarities and differences between the two.
Sure. So there are distinctions between both. However, I would also say that both play on one another. So if you think of a continuum, there's QA and QI. I do believe that you need QA as a foundation to implement quality improvement. But when you're thinking about distinguishing between both areas, I would say quality assurance, or QA, tends to be a more reactive, sometimes punitive approach to an audit, to a formal regulatory body. So those audits tend to be sort of predetermined or prescribed to you in terms of what you're looking for. It often relies on some sort of corrective action plan to address any deficiencies. So you can tell even by the words that I'm using to describe QA, they tend to have a negative connotation: deficiency, corrective action plan, punitive. And, I would also say that unfortunately QA relies on one person. And I make that distinction because QI is not that. It is not one person. It shouldn't be the responsibility of one person. Rather, I think one of the benefits of quality improvement is that it is, in fact, a collective team-based approach, that you really can't make sustained, meaningful improvements unless you have all of the right stakeholders and team members on board and bought into the quality improvement process. So I would say those types of definitions might help to better understand QA versus QI mentality or processes.
So as I hear you talking about quality assurance, another word comes to mind, and that's compliance. Mm-hmm. How do you see the concept of compliance fitting in between QA and QI in this whole sort of quality universe?
Yep. So I would say QI typically falls under the corporate compliance officer type role. It's a formal process that's kind of predetermined for you. So when you think of compliance, you often think about contract compliance. So when you think about contracts, those are deliverables that are set for agencies or program managers to accomplish. So that in and of itself is compliance driven. You must be in compliance with your contract, which outlines the specific deliverables you're trying to achieve.
Yeah, when I think about, compliance, maybe like a chart audit, or like, do you have a patient consent? That doesn't necessarily speak to the quality of care, but it's a quality compliance item that must be there.
Those are processes or checklists that are either mandated or set forth for you that you have to comply with, that you have to follow. Those are all sort of those QA type practices that are typically associated with a compliance type structure or format.
Yeah. So a lot of our listeners are, quality driven and data focused individuals. So what's a good way in terms of the measurements to sort of say, what does a QI measurement look like versus a QA measurement? Because I think that's a really great way to understand the differences.
Absolutely. And I think when I explain it to our partners or our stakeholders or people that we are working with as part of a team, those QA measures are often process measures. So you just think of typical counts. So counts of referrals, counts of face-to-face, counts of billing errors. And so those to me are more process type metrics versus quality improvement type metrics are more outcome based. So you're interested in your agency's mission in tracking those types of more meaningful substantive outcomes rather than just mere process counts. So when you think of outcomes, you're thinking about improvement in overall functioning. You're thinking about satisfaction type outcomes. Another item would be if you're a housing program, the main goal of that housing program is to achieve some sort of permanent or stable housing. That's an outcome. That isn't just merely a process count. Another type of meaningful outcome measure would be, did the customer or your client report improvement in their services or the way they were delivered or improved functioning. So I think when you think about outcomes, you're really taking a deeper dive on what is it you're actually trying to achieve by implementing this program, rather than just mere process counts that probably most likely are prescribed for you in some sort of QA compliance-driven contract.
So I think that brings me to evidence-based practices, right? When we talk about prescriptive methodologies, if you deliver these service activities in this way, on this cadence, you should expect to see positive outcome results. So how can you tie evidence-based practice models? How can you weave that within the QA to QI sort of infrastructure?
Right. So your evidence-based practices or models, they're evidence-based because they know there's data that says you actually achieve meaningful outcomes. So oftentimes, if you're implementing an evidence-based practice, they will, good news, identify outcome measures for you because they've done the thinking and the thoughtfulness of what it is they're really trying to achieve. And so when you're thinking about evidence-based practices and monitoring whether or not you're achieving those outcomes, they most likely will tell you what those outcomes should be. Now, certainly there are some process or practice metrics that you have to follow to get to that outcome, and those would be more QA driven. And so that sort of speaks to how sometimes you can't do QI unless you have that QA foundation in place. But good news is that if you are implementing an evidence-based practice model, that is of support to you because they have already sort of gone through that process of identifying what are those meaningful outcomes that this service is trying to achieve.
So if you're going to implement one of these models, the QA part is how well are you following the model? Mm-hmm. And if you are adhering to the model and your QA tracking tells you that you are, then you should expect to see the outcomes from the model, which are that people are better off.
Yeah. And so that speaks to that continuum, that QA and QI sometimes work hand in hand.
Great. So what are some of the activities from sort of a staffing standpoint? So now let's get into the organization a little bit. If I'm managing, let's just call it a quality department, and I've got people were focused on assurance and compliance, and I've got people thinking more about overall improvement and outcome. What are people doing that's different?
Yeah, so if you have an overall QA department, your QA people are most likely doing more of that audit function. They're most likely drafting policies and procedures. They're most likely, if needed, developing developing corrective action plans.
Mm.
So those are all those activities we talked about early on and how to help you distinguish between QA and QI. Those activities are much more standardized. When you're thinking about quality improvement really gets to more of those meaningful, deep dive type exercises with a team. So those compliance or QA activities can often be done by one person. When you're thinking about quality improvement and the types of activities that resonate with that type of model or framework, agencies, organizations should really think about whether or not they have the resources to fully support quality improvement activities. And what I mean by that is that you are willing to have a team support and come together. You're willing to set aside time every week to have quality improvement meetings. You're willing to have structures in place which support more meaningful conversations and trying to get to the root cause. So you're not merely just drafting a corrective action statement, you're truly trying to understand the root cause and why it is we're not achieving these types of outcomes. So you have the resources, you have the time, you have the team and willingness to do more meaningful activities, rather than just sort of creating a checklist or drafting a corrective action plan. While those are absolutely important and most likely could be one of your strategies or steps in the quality improvement action plan, I think the more meaningful activity associated with quality improvement is, like I said, the time, the resources, and the team to sort of collectively make a bigger impact and sustained impact.
So that brings me to kind of a gut punch type question. And it's great that you work for an independent agency and not a direct human service organization. So I can ask you this question on their behalf, because so many agencies that think they're doing quality improvement are really just doing quality assurance. What are they missing? And what happens that there's kind of this illusion that a really well-oiled QA machine is the QI machine when we know, in fact, they're different?
I think what is missing is, I'm not trying to sound hokey or it's really that meaningful buy-in. I think of agencies that had one compliance/QI person, and when you ask them, what did you do with that work? Either A, I did it and I put it away and I put it on a shelf and then I moved on to the next project without any further meaningful discussion with a group of stakeholders or a group of directors or your board. It's sort of, yes, I did the project, done and over with, versus sort of this more meaningful involvement of quality improvement from your board, your executive director, your administrators, your directors, your supervisors, and your direct line staff. So it shouldn't just be the focus of one person. That quality improvement is really something that each level of your organization understands, buys into, and participates in.
So that brings up for me, the methodology that we use most often, the PDSA, or the Plan, Do, Study, Act. How does that fit in? Can you be doing PDSA on one side versus the other? Or help us understand when folks say, yeah, we're doing PDSA. Well, can you be doing it in a quality assurance only way or a QI only way? Or how do folks doing PDSA know that they've got this bigger QI umbrella covered?
Right. So when you're thinking about PDSA, Plan, Do, Study, Act, it really comes down to each one of those phases and being able to implement each one of those phases with a team. And so I talked about earlier the distinguishing factor or marker, I think, what a QA person is versus a QI. QA is, they tend to be on their own, doing their own thing and crossing T's and dotting I's, which is necessary. You definitely need people like that. I do QA all the time, and I recognize the value of it and the importance of it. The shift to quality improvement is that every step along the way in that PDSA model, you have engaged the right team to plan, to do, study, and act. Each one of those phases requires a collective effort from the right team members. And they all bought in, whether it's planning and figuring out what is the root cause. They're all doing activities around that. When they're doing, they're all take onus on piloting new strategies, new change efforts. When they're studying, they're all looking at the data and looking and identifying where, in fact, a change has made a significant difference. And then when they decide to act, they all are sort of collaborating together. How are we going to act on this improvement area now that we know we've achieved the right results? How do we act on it and sustain it? So PDSA really is most effective. That framework is most effective when you have buy-in with a team to support each one of those phases.
I think that team component is a good way to identify it, but I don't want to answer the next question for you. So a lot of agencies, just because of size, resource constraints, money, let's call it what it is, tend to have a role that is, and I see it all the time on job titles, QA/QI director. A lot of times, whether it's grouped together for an individual or grouped together as a department, it does get grouped together. So in those teams and those leaders, what strategies do you recommend for them to be able to, appropriately separate, but not so that they can't see each other, but understand when we're doing one and when we're doing the other?
So I think if you're working within a department that has two, and if I'm understanding the question, that has two roles within one department, distinguishing when there's a time and need for quality assurance and when understanding when quality improvement, when it gets to the next level of quality improvement. So I guess what I'm trying to say is I understand that resources are limited, that time is limited, and quality assurance tends to be easier to administer. But I would have to challenge those organizations that if you really want to sustain lasting, meaningful impact on the entire population as a whole, then it is worth your investment in time in a quality improvement framework and giving staff permission to be involved in quality improvement teams and understanding that, yes, your direct role, your direct responsibility is to administer this type of program. But in doing so, we also value and understand and appreciate your time working on a quality improvement team under our QI department or QA department. So I don't know if that entirely answers the question.
Yeah, I think.
But at the same time, I would say there is a responsibility on administration, on leaders to really embrace quality improvement and invest in it if that's what they really want to see put forward.
I think it's interesting that you say that it's easier to administer. And I think some of the individual nature of it that you mentioned is a lot of what makes it easier. You can assign a task to a person and they can go do it. It's a lot harder to do things with teams, right? Just scheduling, logistically, it takes longer, more logistics involved, getting people together and driving those projects forward. So when resources are constrained, a lot of folks tend to lean on the QA that they have to do and call it a whole box checked when really it's only half of the box. Mm-hmm. What are your thoughts on the program role in QI. So a lot of our health and human service agencies have centralized QA and QI staff who work on behalf of or for or with, or however you want to describe it, with multiple service delivery programs. What are your thoughts on the relationship between quality staff and program staff and how they can work effectively together?
Well, it's critical and necessary. There's no way your quality improvement team is going to achieve meaningful outcomes on behalf of a program unless you have the program supervisor and, more importantly, direct line staff involved in that team. So when I talked about earlier creating buy-in from the top up all the way to your direct line staff, and if you want to achieve meaningful substantive quality improvement outcomes, you really have to have investment and buy-in from the programs you're working with. So the QI person isn't driving the strategies or the quality improvement action plan. Rather, they're facilitating that PDSA model and that corresponding action plan with the program experts. They are the people who have probably the most relevant change strategies or change ideas. They should know their program model and policies and procedures around that model like the back of their hand, and therefore they can really meaningfully offer change strategies based on their experience and involvement with the program.
Yeah, it becomes about facilitation. Like W. Edwards Deming used to say, look to the process owners, because a quality improvement staff person can't actually do any improvement. You can only work with those that deliver services, to project out how you can deliver that better.
Right. And hence, that's why when you think of QA versus QI, the distinguishing factor is the team.
Yeah, that's a great insight. So to sort of go along with that, one final thought, if you had a quality program director in front of you today that said, Christa, I've got QA nailed and I just can't seem to turn the corner to get that true outcomes quality improvement program up and running, what's one thing I could do tomorrow that would make the biggest impact for me and my organization?
Yes.
What would it be?
Yes. So I actually have two things. I would say one thing is if they already have their QA, most likely process metrics. So I would say choose a low-hanging fruit process metric and begin to apply a QI framework around it. What I mean by that is I'm sure there is a QI process metric that could improve or increase or decrease depending on what way it needs to get better. Pick that one, form a team, and begin to strategize just some simple change strategies and how to improve that metric. You got to start momentum so people feel motivated and excited. And QI is a planful, thoughtful experience. So you're not looking for quick, get it done, check it off. You really want to invest the time and resources in thinking about what is it that we're trying to do and making sure I have the right team to support me. So that's the first one. Pick a metric that you feel comfortable with, that you can get some buy-in from some team members and go for it. Start somewhere. And the second thing I would say too, and maybe you could do it hand in hand, is really start sort of sketching out what your quality improvement model would look like for your agency or for your department. So just sketching it out. Is it a QI person who reports to a director? Is it a QI team who reports to a QI manager who reports to a director? So starting to formalize what your QI department process would look like and sketching it out might be another way to start getting into the momentum of applying quality improvement.
Excellent. Wonderful recommendations. Christa, thank you very much for joining us today. This has been another episode of the Data Doesn't Equal Outcomes podcast.
Okay, thank you.